Our next guest is voicing concern over the Trump administration's possible cuts to certain LGBTQ mental health resources. The National Suicide Prevention Hotline was created in 2005, and in 2022, it transitioned to the easy-to-remember number 988. The next year, specialized counselors were added who focus on LGBTQ youth. Now, in leaked draft documents, the Trump administration appears to be considering cutting those services.
Since 2022, nearly 1.3 million contacts for LGBT specialized services have been made out of the more than 14.5 million total contacts. That's a lot of people getting a lot of help. A statement from the White House says the total funding amount isn't changing, but it does not, quote, this is a quote here, grant taxpayer money to a chat service where children are encouraged to embrace radical gender ideology by counselors without consent or knowledge of their parents, unquote. The Trevor Project provides suicide prevention and crisis intervention for LGBTQ youth and also provides services through the National Suicide Prevention Hotline. The nonprofit CEO, Jaymes Black, joins us now. Jaymes, good morning. Thank you so much for being here.
Thank you for having me.
This is such an important story. So basically the way it works, if you dial 988 and you press 3, you will get a specialized counselor who's been trained to speak to and help LGBTQ youth. If this goes away, and it's still an if, then these youth will be routed to just general counselors. Why do you think that's not sufficient?
Well, it's not sufficient because we know that there are communities that are disproportionately at risk for suicide, like our veterans and LGBTQ plus youth. And they require a unique support model, a unique care model that is tailored to their specific community. When a youth calls 988, an LGBTQ plus youth, and they hit press 3, oftentimes that's the first time that someone affirms them, that someone tells them that you deserve to live, that can actually de-escalate and save their lives. Sending them to the general 988 line can be dangerous and fatal.
So what kind of services could be cut? And the way it's described, somebody might die if they don't have access to this.
This is a matter of life or death, period. And a couple of facts that I want to establish up front about 988 was established with strong bipartisan support. It was signed into law by President Trump during his first term. As you mentioned, over 1.3 million LGBTQ plus youth have contacted the line and have received free, high-quality care. And it was an evidence-based, data-backed decision. We need to continue the support because it is a matter of life. Real lives are on the line, is the bottom line of the story and why we must continue it.
And another stat quickly that every 40 seconds, an LGBTQ youth considers or contemplates suicide.
That is correct. We know that there are 1.8 million LGBTQ plus youth in the United States that seriously consider suicide, and every 45 seconds, one attempts suicide.
Wow, one attempts suicide.
Correct.
I'm glad you pointed out that President Trump, in his first term, signed this law. What have you been hearing from the youth themselves about what this potentially means for them?
They are terrified. They are asking if their lives even matter. When potentially the highest office of the land is considering cutting this critical service, they have to think about, do they even care about me? And is my life worth saving? And that's what we're hearing. They are literally terrified and afraid.
So what are you urging people to do, the public, in response to this?
Well, first of all, I'm urging Congress to stand by its long-standing precedent of ensuring that we are saving lives for those disproportionately affected by suicide. There's a long-standing precedent that they've already established. I am stressing to the Trump administration to continue its unity that it established with this strong bipartisan support with LGBTQ specialized services that it established back in 2020. And I'm letting the public know that this is a matter of life or death, and we cannot afford to discontinue these services.
Important information there. Jaymes Black, thank you very much for being with us.
Thank you for having me.
Appreciate it.